what actually is a pandemic and how does it differ from other types of health crises? Four terms that are important for us to distinguish between are endemic, outbreak, epidemic, and pandemic. And each of these categories is used to describe infections like cholera, HIV, and COVID-19. But other non-infectious conditions like hypertension, cancer, and violence have also been described in the same way. So, for example, you might remember that during COVID-19, racism and ageism were both described as shadow pandemics. How can we distinguish between endemic, outbreak, epidemic, and pandemic? These categories differ based on how many cases of a particular condition there are, whether we were expecting that number of cases, and the geographical spread of cases. And we're going to break this down and look at examples to help us distinguish each category. And as we're talking, these definitions that I'm going to present might seem straightforward, but applying them is actually really tricky because the real world is evolving, it's changing, and it's complicated. Let's look at an example. So HIV started in West Africa as an outbreak, but then it became epidemic across the African continent for several decades. By the late 1900s, it was a global pandemic, but by the 2020s today, HIV is now endemic in some parts of the world. Let's start by talking about endemics. An endemic refers to a condition that is present at a fairly stable, predictable rate among a group of people. So in other words, the observed number of cases are approximately the same as the number of cases that experts and health authorities were expecting there to be. So it's not unpredictable and it's not overwhelming the healthcare system. The term endemic can be used when discussing something as small as a town or as large as a country or a continent. For example, malaria, which is caused by a parasite that is spread to people by mosquito bites. Malaria is endemic in the African continent as a whole, whereas hepatitis B is endemic worldwide, but rates are higher in Asia and Africa. So we would say Asia and Africa have high endemicity, and rates are lower in Europe and North America. So we would say Europe and North America have low endemicity. Now let's talk about outbreaks. An outbreak happens when there is a sudden increase in the number of people with a condition. And this increase is greater than is expected, so it is surprising. It was not anticipated. And we know there's been an outbreak when either there are more cases of an endemic condition than expected, or the condition is now found somewhere it hasn't been before. So a single case can actually be an outbreak if it's in a new region. Outbreaks are limited to relatively small areas, and this is actually part of their definition. If they were to spread geographically, they would be an epidemic. And if they were to spread globally, they would be a pandemic. So some outbreak examples, and you might be able to think of some as well. There was an outbreak of measles specifically around a US theme park in 2015 because there were a large number of unvaccinated children who came in contact with measles at that theme park. Another example you might hear on the news and in signs in grocery stores when there's an E. coli outbreak, because this is a bacteria that can be found in lettuce and ground beef that is sold to us at the grocery store. Another example of an outbreak was when 2010 Haiti had a massive earthquake, and no one expected that as a result of that earthquake, there would be an outbreak of cholera in that country. The third term we are going to discuss is epidemic. And an epidemic is just an outbreak that has spread over a larger geographical area. So one example is the Zika virus from 2014, which again is spread by mosquitoes, and it actually started in Brazil, but then it became epidemic when it spread to most of Latin America and the Caribbean as well. Our second example of an epidemic is smallpox, which was brought to North America by European settler colonizers in the late 1700s. The spread of smallpox began in specific First Nations territories, but then continued to spread to much of Turtle Island, or what is now North America. And this epidemic greatly reduced Indigenous populations. Another example of an epidemic is the opioid epidemic, which is really tightly connected to the approval process for opioids, the marketing of those opioids, and questionable prescription practices, which have been thoroughly interrogated in retrospect. Now, the opioid crisis began as an outbreak, but spread really rapidly across Canada and the United States and many other wealthy nations. Our final concept is a pandemic, which is an epidemic that spreads around the world. The most famous example of a pandemic is the 1918 Spanish influenza, which infected more than 1/3 of the world's population and killed approximately 50 million people. Here we see a public notice that the mayor of Kelowna posted in 1918. And if you read the notice, you'll see that the closing of public spaces actually really foreshadows and parallels the closing of public spaces in relation to the later COVID-19 pandemic. And there have actually been several influenza pandemics since 1918, including one in 1957, one in 1968, and then H1N1 in 2009. A pandemic example that's not related to influenza is the bubonic plague, also called the Black Death, in the 14th century. This plague was caused by infected fleas that were traveling attached to rodents like mice and rats. So when a human came in contact with a mouse or a rat that was carrying these fleas, the fleas would actually bite the human. And of course, more recently, we have seen the COVID-19 pandemic. And there are many factors that will influence how far a condition spreads and why it becomes pandemic. But two important factors are how easily the condition can be transmitted from one person to the next, and the movement of people. How much are people moving around the world, for example, by airplane, where infections can be brought to new parts of the world within just a few hours. Let's think for a moment about how the movement of people has changed over time. So this is a map of the spread of the bubonic plague in Europe from 1346 in the dark green color all the way to 1353 in the light brown color. So we're talking here about an 8-year period for the bubonic plague to spread over just one continent, with countries that are really closely together and with borders that are touching. For example, the light orange shows that in 1348, the disease had arrived in English ports, and it took a whole year. It wasn't until 1349, the dark orange, that the disease had spread just to most of that country. Now contrast this to COVID-19, where the disease didn't just spread between one country or one continent, but it spread around the entire world in just a few months.